UNESCO holds an online climate change conference with Tzu Chi discussing disaster relief. Tzu Chi Hospital in Indonesia was recently completed and is now serving COVID patients. I'm Sean Scanlon. This is DI Headlines. Let's get started. The International Seminar on Climate Change and Disaster Relief, hosted by UNESCO, was held online on October 2nd. 6 research teams from different countries such as Japan, Taiwan, Indonesia, Thailand, and Malaysia participated. This year, Tzu Chi Foundation was invited to give a talk on the topic of disaster relief. Let's take a look.
The downpour of rain within 10 hours, which is equivalent to 3 months rainfall.
In 2013, Typhoon Haiyan devastated the Philippines, and the local Tzu Chi chapter enacted a work for relief program to help the people.
More than 2,000 prefab houses were completed to provide housing for the disaster survivors. Actually, almost every year we've been moving around Philippines. As I mentioned, that we're having about an average of 20 typhoon disasters. Whenever there's a major one, we use the same approach in inspiring these people and hopefully to develop them to become independent,
which benefited as many as 10,000 families.
A successful relief model from Taiwan's Tzu Chi Foundation. Sharing this method with the rest of the panel, the 6 research teams from 5 different countries learn from one another.
In this loving, caring environment is, I think, really an important lesson, and certainly your success and the numbers of people that you're able to mobilize is quite inspiring. Today is a really good example of how we're educating ourselves and each other.
Under extreme climate change, how can disaster relief bring gender equality and support to disadvantaged groups? The UNESCO Chair Project is accumulating the methods and bringing it into action.
As forest fires continue to burn in the United States, many places are in need of assistance. Tzu Chi volunteers in Seattle held a 3-week handmade mooncake charity sale, hoping to use this festive time to support disaster-affected residents. Here's more.
Colorful mooncakes aren't just for self-enjoyment. Volunteers in the United States prepared these mooncakes for a charity sale.
Once volunteers heard about the mooncake charity sale, they were very excited. A lot of volunteers are willing to help. For 3 weeks, we received good responses, so we felt very confident.
Forest fires and hurricanes struck the United States, and along with a strong earthquake in Haiti, many places are in need of supplies. Tzu Chi volunteers in Seattle initiated a mooncake charity sale as volunteers dealt with making mooncakes to packaging the finished product. 80-year-old senior volunteer carefully peels walnuts, testing both vision and patience. Amongst the volunteers, a couple from Indonesia were also invited to help make mooncakes. My relative-in-law asked me to volunteer here. This is my first time making mooncakes. Different mooncakes are packed with different feelings, as each step during the process requires volunteers to carefully weigh ingredients. After baking mooncakes 3 times, it is finally completed. The delicious mooncakes and warm-hearted greetings are the best blessings to volunteers and mooncake recipients.
Guatemala is rich in traditional culture. Although local Mayan women have good knitting skills, they lack sales channels, and fewer tourists due to the pandemic has made their lives harder. For this reason, jihosa distribution, helping a total of 500 families in need. Take a look. These big, colorful kites are part of the traditional culture of Zacatepecus. It symbolizes the ability to convey messages to deceased family members. Every year before the Day of the Dead, the local kite festival attracts a large number of tourists to come here for a pilgrimage. But this special kite is very different. It represents a local government's welcome for Tzu Chi. Also kicked off the distribution at the Escuela Official Mixta No. 1 in Zampango City. Almost all women who came here were local Mayan people with weaving skills, but few sales channels make their lives anything but easy.
This is the first time a charity organization came to care for us. This never happened before.
We really appreciate Tzu Chi's assistance to Supango City's 5 villages.
A total of 500 households were helped, and each household was able to receive rice, sugar, flour, noodles, biscuits, and cooking oil. The reason behind the smooth distribution was Paula, a netizen who reported to Tzu Chi.
Tzu Chi Foundation doctrines are all about love and charity. I am very grateful for this and have been following on Facebook for 10 years.
With these nourishing supplies and the love of the public, these people can continue to raise their heads courageously and face the many challenges of life. In June and August this year, the Geelong government and the Tzu Chi Foundation worked together to supply disadvantaged families with fresh produce boxes and living supplies. In order to thank the Geelong wholesale market for their support, Tzu Chi volunteers hosted a gratitude event with music and playful sketches to entertain the vendors. Let's take a look.
It's a typical morning at the Geelong Wholesale Farmers Market, except there's now an added musical performance. There are also funny sketches to entertain, as Tzu Chi volunteers are here to express their gratitude to the suppliers for their support in the fresh produce boxes during the summer for over 2,000 disadvantaged students.
This is the first time we've done something like this, with only about a week of preparation. However, seeing how happy the children were in receiving the fresh produce boxes, it was worth all the effort.
In total, 2 distributions were held, with the wholesalers using their days off to prepare for. They would start packing at 3 in the morning. Although rain and typhoons hindered their harvest at times, they still picked out the best quality of harvest for the students.
The first time was during the flooding in the south, and the price went up, but the sellers did not raise the price on us. They sold it to us at our agreed price and took the loss. We were so moved.
I'm quite happy that we had the chance to participate in this giving by contributing what we could without thinking what's in it for us. We all had the heart to complete this event successfully.
Looking at some footage of the event, the vendors will surely continue to spread their love in their work.
Due to Taiwan's declining birth rate, the population is slowly moving towards a super-aged society, with many of the families seeing the elderly taking care of the elderly. When physical strength is a problem, assistive devices are a great need to ensure everyone's safety, especially disadvantaged families. Thankfully, Tzu Chi Foundation has a second-hand assistive device platform to help those families. Here's more.
This electronic bed is being retired from the Zhen family. The family quickly called Tzu Chi to return the bed so another who might need it can use it.
Tzu Chi ensures affinity with all those they come in contact with, whether they can afford to purchase an assistive device or not. If they're willing to use it and it comes in handy, our second-hand assistive devices can be sent to them. We do our best to help.
Due to the decline in birth in Taiwan, the population has been an aged society, resulting in the elderly taking care of the more elderly. Among them is Luo Mingzhong, who is 66. He takes care of his 91-year-old father and needs assistive device to help.
Purchasing a bed like this costs money, but Tzu Chi is very thoughtful to provide this type of service in caring for patient families.
Meanwhile, Xie Xiangying's mother is being discharged from the hospital, so she has applied for a hospital bed and oxygen concentrator to aid her mother's recovery.
This increment is such a big help to our family, as when the patient returns home, they will be happier because the medical equipment can help. The oxygen concentrator is easy to use, as well as the electronic bed. we can easily operate it.
很简单，家属一用就会了。
Tzu Chi's assistive device team sends equipment to families in need, making sure they are cared for and not alone in their recovery.
The construction of Tzu Chi Hospital in Indonesia was started in 2015 and completed recently. To cope with the COVID pandemic, the first phase of the hospital, the Epidemic Prevention Center, was opened in June this year, while the second phase of operation, inpatient and outpatient services, started on October 1st. Many volunteers joined the training to be medical volunteers. Take a look.
Tzu Chi volunteers appeared in the hospital not for medical attention, but to join training.
We have benefited a lot from this training, especially for the hospital, management, and facilities. The most interesting thing is although we are not medical personnel, the hospital still taught us some knowledge about caring for patients.
Mensupport tenaga medis yang ada.
Relawan ini kan orang-orang bagian yang penting.
Medical volunteers mainly help the patients in our hospital. For example, many people do not know much about the operation room. That's why we need to provide volunteers with the information so that they can explain to our patients and comfort them later.
Under an emergency situation, volunteers need to have first aid knowledge and be calmer than the general public. To guide the public, volunteers also need to provide warm greetings.
We should provide the best service to everybody, especially those who come to seek medical treatment. We strive to treat patients with love and compassion, hoping that they can recover as soon as possible.
With a simple but solemn opening ceremony, Tzu Chi Hospital in Indonesia officially opened on the 1st of October, bringing blessings from all over the world.
In order to speed up the nationwide vaccine coverage, the Indonesian government's military collaborated with local organizations, setting up large-scale vaccination stations in order to vaccinate the public. In Medan and Badong City, volunteers and medical workers serve over 1,000 people per day. Here's more.
Tzu Chi Medan chapter and the military collaborated for the third time, providing vaccinations to citizens. The goal is to service 6,000 people within 3 days. We picked a suitable venue for the vaccination station. It's quite spacious. This way, people can maintain social distancing, and when we serve citizens, we won't have to worry about contracting COVID-19. With a large venue, more volunteers and medical workers are needed. At the scene, it's not just Tzu Chi volunteers who are contributing. 50 medical workers and staff members from a military hospital also joined in to contribute.
The government vaccination plan hopes to vaccinate 2.5 million people per day, so this is why the military worked with Tzu Chi. It's because we want to speed up nationwide vaccine coverage.
In order to increase nationwide vaccination coverage, everyone must act. Besides Medan, Bandung City started to lower the age requirement for vaccinations. Recently, students from the age of 12 to 18 may receive a vaccine shot. I want to thank the health center for providing vaccinations to us students. I also want to thank Tzu Chi Indonesia chapter for providing a good place to rest.
In our village, it's hard for us to find big venues for vaccination stations. We thought of Tzu Chi's place and their volunteers, so we chose here to provide vaccinations for students.
Facing against the virus, locals receive vaccinations in hopes of better protection and a chance to get back to the once normal life.
Currently, over 80% of COVID patients in Malaysia are quarantined at home. The government, through the COVID Evaluation Center, is monitoring their conditions remotely. If needed, the center will then send an ambulance for the patient to receive treatment at the hospital or quarantine center.
As of September 2021, there have been over 2 million confirmed COVID-19 cases in Malaysia, with more than 170,000 active cases. Among them, 80% are quarantined at home, which means the involvement of nearly 150,000 people. Since January of this year, the hospitals and the quarantine centers are overcapacitated. Thus, the Ministry of Health and Welfare deemed that patients categorized as level 1 and 2 are to quarantine at home, while level 3 through 5 are at designated hospitals and quarantine centers.
Those under 60 without such risk as diabetes or high blood pressure are categorized as level 1 or 2. These minor patients can quarantine at home for recovery. Those 60 and over, even if they don't have risk, might suddenly have severe symptoms like difficulty breathing. They are likely to suffer from breathing problems, but do not notice and end up measuring at a low oxygen level of 95. So they are all required to stay at quarantine centers.
The confirmed patients must adhere to strict home quarantine measures set by the Ministry of Health and Welfare. Those who live in the same household as a confirmed patient must reduce contact and also adhere to the rules to protect themselves.
Confirmed patients cannot cook the food. They can only receive meals at the door. The family must leave the door area before the patient can come to pick up their meal. Doing the laundry for the confirmed patients must be done by wearing a mask and gloves, and the clothes must be washed separately.
Dr. Go reminds home quarantine patients and their families to exercise caution, as if the patient experiences more severe symptoms, they must immediately go to the hospital or clinic.
For example, if they have had a fever for 3 days and it won't break, or when they walk, they're out of breath, or if their heart or chest hurts, or can't hold down food, nor care about what's going on. When you ask them questions and they don't really give an answer, then they are lacking oxygen. If it's children, symptoms may look like not eating, or they can eat and immediately vomit. For babies, if you see the breathing to be hard breathing, like their chest caves in and the muscles on their neck are strained, or sounds of wheezing are present, those are all dangerous signs.
In order to monitor those quarantined at home better, the government set up an evaluation center for COVID-19. Home quarantine patients must report their daily health condition, so the Ministry of Health and Welfare has a better grasp on the situation. And if need be, they will send out an ambulance to take the patient to the hospital or quarantine center for treatment.
In Malaysia, at the peak of the pandemic, COVID-19 reported cases experienced all-time highs, but actually, there are still many people who are unable to get COVID tests and evaluations due to government disabilities and a lack of proper transportation. Team of Dr. Tan Xiangning participated in the mobile COVID-19 evaluation center project as she travels into remote regions serving patients with movement disabilities. While she's there, she has acquired important life lessons. Let's take a look.
We have to ensure that our phone is safe, so we wrap it in plastic. Before wearing protective clothing, I must go to the restroom and drink some water, but I can drink too much and cannot consume too little. If I didn't drink water, I won't have water at all later. Okay, so we have to wear it now. We went to the third house, and over there, one person contracted COVID-19. The other 8 residents did come into contact with the personnel, so they have to wear the pink waistband. Today, we are doing a second detection test. The first test showed everyone to be negative, and after 10 days, the second test will determine if they can remove their waistbands, meaning that they are out of quarantine.
In order to speed up the evaluation time of patients' quarantine situation, Team of Dr. Tan Xiangning will study the patient's medical backgrounds while on the ambulance. She has to also wear protective clothing while sitting in an ambulance without air conditioning. Along with the bumpy roads, medical workers must endure uncomfortable feelings.
We didn't find his home on the first visit. Maybe his home is too far away or remote. There are no door plates in that kind of rural area, so we have to rely on locals to ask who and where, and ask about what street does he lives on. After making a turn, we discovered errors, so we must come back out. While driving the ambulance, I felt very uncomfortable, and I was also wearing protective clothing. It didn't feel good, and after lunchtime, it only gets worse.
Carrying on the responsibility of managing a center for evaluating COVID-19, Team of Dr. Tan Xiangning admitted that the experience this time has changed her life.
I felt bad because normally we ask the patient to be there by 8. We question them if they arrive at 10, but we never think in the patient's situation, whereas they do not have transportation, means to leave their homes and seek treatment. They need someone who can drive them to the places. Under these circumstances, it's tough for them to come to our clinic. This really educated me.
During the pandemic, life is tough for many people. If only we can have more compassion and patience for one another, warmth will arrive to corners of society.
Although it was the time of the pandemic, the Tzu Chi Eye Center in the Philippines did not stop helping others. Recently, doctors of the center helped a child with congenital glaucoma and a child with recurring sty to perform surgery so that they can have the ability to see the world. Here's more.
11-year-old Sophia had a granuloma on the lower eyelid on her left eye, which made her mother very worried and took her to the Tzu Chi Eye Center for treatment.
I was really worried for my daughter. My thoughts were filled with, what if the thing in her eye grows even bigger? Will she be able to still see?
It turns that this granuloma was caused by recurring sty. The doctor first used drugs to reduce its size before performing surgery to remove.
During the pandemic, a patient who needs to undergo surgery at hospitals will have to spend quite a sum of money on swab testing and the expensive operating room fees. That is why we decided to do the procedure here instead. We were able to come to Tzu Chi Eye Center for surgery this time. We are very thankful to the doctor for her concern and help.
Gloria's 10-month-old son, Generous, was born with glaucoma. In order to help her son find hope for recovery, Gloria traveled thousands of miles from Zamboanga City to Manila.
As a mother, I was devastated when I found out about my son's condition. I was blaming and asking myself where I went wrong in taking care of him.
The Tzu Chi Eye Center provides treatment for Janus and contacted a team of physicians from the Zamboanga to continue his follow-up.
I thank Tzu Chi because they helped us without any hesitation, and despite the pandemic, they really found a way to assist us.
Before returning to Zamboanga City, Glory donated a little money she had to the Tzu Chi Eye Center, hoping to contribute her love to others.
Jai Tzu Chi volunteer Lin Shujing and his family in May of this year planted traditional Chinese medicine herb on fields that have been idle for more than 10 years to be provided to the Jingsa boat in the Hualien. On the day of the harvest, more than 40 Tzu Chi volunteers came to help. I leave you with these images. Thank you for watching. Goodbye.